Peds Patrol here, and this is a total fire hazard, a complete no-go, and this is why. So let's talk about tracheostomies, which are holes right over here where your throat exists to have access to your breathing tube or your windpipe. These are really important for children who can't breathe on their own. So for example, if they have neuromuscular conditions, or if they have head injuries or spinal cord injuries, they've had severe trauma or birth injuries or genetic conditions, a tracheostomy may be the only way where they can actually breathe. What you don't see in the video is what's actually either in front or behind the wheelchair, which is there is usually an oxygen tank. There's usually a portable oxygen tank which supplies the tracheostomy with either pressure, flow, or oxygen. And we'll look at that symbol right over there, that yellow one. What is that? So that's an oxygen warning sign. And what that really means is that you have compressed gas and an oxidizing agent. So if you have oxygen, heat, and a fuel source, such as an oxygen tank, a flame, and a lighter, this can make a fire really, really bad and really, really dangerous. So tip number one, if you are beside a fire source and you have either a child or a family member with an oxygen tank or with oxygen prongs, this is very dangerous. You can cause a house fire and cause severe damage to your environment. So definitely keep fire away from those people. Tip number two, when you're taking away the breathing tube connector to the tracheostomy, you're depriving that child or adult with oxygen, and they need oxygen to breathe and as well as survive. So even those few seconds make a difference, and they do count. Number three, and we often forget this, is when you are having a birthday party or celebration, always have a fire extinguisher beside you or near you. You never know when a birthday party can go wrong where you need the help of a fire extinguisher and your local fire department services. Number four, if you do have a child with medical complexity or going to a birthday party with a child with medical complexity, always make sure that your guests as well as the organizer know about your child, their limitations, their strengths, as well as making sure that if you're dropping them off, that somebody is trained and know how to use the medication, the oxygen tank, and additional supplies that are there. All kids should have fun, just make sure you do it in a safe and healthy way.